quality of class, have a score. 2 until 4 is final score. Asking questions or answer my questions have another extra points. And you have maybe 8 until 10 remain for the final, your MCQ test for the final exam. So now I ask some questions for the students, and some students have a activity. Can I see? Which one happens? Yes. What's your name? Just for EV pen. Okay. What's your name? Where are you? Have a positive reactions in the 120. It means that the negative. So in another patients have a positive in the 180 or upper. We say the positive. So ST is ST have a two manner, positive, negative. Okay? I ask you, image 1 patients, patients 1. It's a positive. I ask you, these patients have acute infections or chronic infection. The brucellosis is positive, but I have to determine active or chronic because the medicines that I recipient for these patients is different together. Is acute or chronic? Acute. Dependent on the no. One. Okay, it's good. Look at this. For our immune systems, when contact with the antigens, produce some antibody. Which antibody? IgM, IgG from 1 to 4, IgD, IgE, and IgA. Okay, but in the brucellosis, which one is produced in the IgG and IgM? In the other side, if the infection is acute, produce IgM, and if the chronic is a IgG, is a chronic. Okay. Look at this. The standard tube test detect all of these antibodies together. Patients is positive. It means that IgM or IgG. We cannot detect the chronic or acute. For the detections, I need another test. We use 2ME. 2ME. Look at the 2ME in the red line. 2ME test. The procedure is the same, exactly the same with the standard tube test. But we use the PBS for the standard. For the 2ME, use the 2ME buffer. Just difference is here. Another procedure is the same. So if you have questions for this procedure, ask. If you don't, go to run the test. After finish, I talk about the mechanism of 2ME. Talk. Okay? You give me a promise. We don't talk in the class. Okay? We talk about second test. It's a Wright. So the Wright test is a test for the detections for the brucellosis. Comes from the bacteria that's called the brucella. It's a zoonotic disease. It means that it's common between the animals and humans. So transmitted the bacteria with the milk productions, like as milk, cream, ice cream, and cheese, and so on. Okay. The symptoms with the brucellosis is the same with the rheumatoid arthritis. Okay, is the same. But for these patients to determine the patients have arthritis, rheumatoid, or brucellosis, we use the brucellosis test, like as Wright test. Look at this just for the black. For the detections, we use the standard tube test. It means that the standard procedure or method for the detections of brucellosis. In the laboratory, choose the 6, but in this class we choose the 4 tubes. 1, 2, 4. Okay. The PBS is a isotonic solutions, that is a serum light. 900 microliters or 900 lambda. PBS I add just to tube 1, 2, 3, 4, 500. Okay. The serum of patients 100 lambda just for tube 1. So have sum of this 900 and 100. It means that the 1000. So from this tube 1, I have a 1000 volumes. I choose the 500 of volumes and add to the tube 2. It's a dilution. So this is repeated again for the tube 3 and repeated for the tube 4. After that, I out the 500 of tube 4 to out. Okay? Now all of the tubes have a 500 volume. Now I add the antigens of brucellosis, of brucellosis bacteria. All tubes 500 macroliters from tube 1 until tube 4. So it's a semi-quantitative test. It means that we can report the dilutions of the patients positive. The dilutions in the tube 1 is 1 to 20, 12, sorry. In the tube 2, 140, 180, 160, and another, if I have another tubes, is a factor of 2, 60, 300 of 12, and 600 of 40, and again. Okay. It's a semi-quantitative. It means that in somebody have a positive in this tube 1 or tube 2. In this manner, we cannot go to the report the positive. Exactly in this manner, we have cut off here. It means that positive patients, negative patients. It means that if I have a positive reactions in the tube 2, and it's a 140, what's your interpretations? It's a percent. We need to be quiet, just work, not talk. Okay? If you need to add some things with the slowly voice, not. Okay. I asked one questions for your activity, and which one give the true answer, I give the extra point. Are you ready? We have a patient that RF is negative. Okay? What's your imputation?
There is no infection, or it's alt infection.
Not infection. The rheumatic arthritis is not infection.
Don't have.
Okay. We have a patient that is a rheumatic factor is negative. Your imputation is the no rheumatic arthritis. Okay. Another interpretation? No.
We need to make extra test. To make sure.
This is versa of your first interpretations. The second is true. But look at this. If I have in the laboratory results the rheumatic factor is negative, we have a patient that I cannot rule out the rheumatic arthritis. So we can need to add another confirmed test, like as FANA, or another test like as CH50, like as another. So when you see the rheumatic factor negative, that not means that the patients don't have rheumatoid arthritis. Okay, another question. In these questions, nobody gets nobody points. Okay. We have a 4 years old girl that 40 years old girl that is RF positive. But do you know the symptoms of rheumatoid arthritis? Is the complaint of morning stiffness with these joints. When the patients have rheumatoid have a morning stiffness in the joints, exactly in the hands, and in the morning cannot move their hands. So no symptoms of hands. What's your pretension? The laboratory give me the patients have rheumatoid arthritis, but the patients show me the clinical symptoms of no arthritis. What's your interpretation?
It is a new infection, and maybe
They are rheumatoid and is not infection. Infection is come from the bacteria or virus. It's autoimmune disease. Okay?
Yes.
Complaint.
Yes. And how many infections become early before?
No.
Doctor, just don't retard the disease.
Again.
Don't retard the disease.
Don't.
Doctor, it's not happening.
Actually, just a moment. Don't. Demeter. What's mean the Demeter? Determine. Okay. Don't determine which one. No. Nobody is okay. No interpretation. Okay, you are physicians. Look at the age. The age is buluk. In the buluk, in the buluk years, we have some autoimmune reactions like as SLE. So SLE is confirmed with the buluk and with the girth. In the another side, I told you, the SLE in the SLE patients, we see the rheumatoid factor is positive. So these patients don't have arthritis rheumatoid, but maybe have SLE disease. Be careful what test is important, very important in some case like this. Okay? If you have any questions, go to another test. Do you have questions? Okay, I asked 2 extra questions, but nobody gave true answer. And it's my honor to be with you for the practical immunology. I have good news because it's my first time in Sabtain and along with in Karbala. So I have a gift for you from me. It's 1 point from the final exams. It's my gift for you. Okay, so you have a 1 point off for your final exam. Today we talk about two tests, agglutinations and Wright Test. So agglutination test based on the basic of antibody and antigen reactions, we say agglutination. So we have so many tests with this basis, like agglutination, like as RF or CRT and PRs and so on. So today we talk about the RF. What do you know the RF? Rheumatoid factor, okay? And it's extra point for you, extra score for you. Rheumatoid factor is, look and be careful for the abbreviations. Rheumatoid factor, rheumatoid arthritis, or arthritis rheumatoids. So, in the rheumatoid arthritis, divided into 2 categories, positive RF, negative RF. Okay, in the reference books, reported rheumatoid, arthritic rheumatoid patients that is the positive for rheumatoid factor, say seropositive. So that means seropositive rheumatoid arthritic patient, it means that that patients have positive for rheumatoid factor. In another side, we have rheumatoid arthritic patients that is negative for the rheumatoid factor, and the reference book call these patients seronegative. Okay? In another side, seronegative, it means that the RA patients that is not produce rheumatoid factor. So, all of the, for this categorize, the 80% of rheumatoid arthritis produce the rheumatoid factor, and 20% is negative for rheumatoid arthritis. So, as you see, the rheumatoid factor is not specifically for detections of rheumatoid arthritis, but it's necessary for detections. If a patient have rheumatoid factor, we cannot rule out the rheumatoid arthritis disease. We need to confirm the rheumatoid arthritis with another test like a CCP or FANA or ANA and so on. So, in the other side, rheumatoid factor is produced in the other disease like as cancer, like as another autoimmune disease, for example, SLE, systemic lupus erythematosus. So, if a patient have RF positive, it is not mean that rheumatoid arthritis. In the other side, rheumatoid factor negative is we cannot rule the rheumatoid factor. So it's a little complex, but when you go to the hospital and see some results of tests, you can find the results. For the productions, for the test procedure, 1 drop of sample plus 1 drop of antigen. Okay, you mix, and after 5 minutes, you read the test. Okay, it's a so fast test for screening of patients in the laboratory. What's the results of test? Look at this. If an antibody that's present in the patient's serums, it means that our antibodies means that our rheumatoid factor. The rheumatoid factor is the base of antibody that binds to the antigens we use in the test. They combine together, and the weight is complex and more heavy and precipitate in the slides. So we can see the precipitations thus. We say agglutination. So when you see this agglutination, it means that positive, and no precipitations, it means that the homogeneous of antibody and antigens, we say negative. Some laboratory divided the positive in 4 manners. 1, 2, 3, 4. Plus, it means that the strongility of the reactions. The reaction is positive, but which strongility? Weak positive, moderate positive, upper moderate, and strong positive. So the upper of the 4 we don't have. We don't have yet, or in the any of laboratory don't report the 5 positive. Is a mistakenly. So the 4 is top of the reactions in the laboratory. So as you learned, and any of you have any questions, we can write the test. First I run 1 sample, and after you run. Have a question? No? Okay. I can run the test and you see the how.